Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
Temporary Aid for Needy Families, or TANF, is a $16.5 billion grant program managed by the Health and Human Services Department. A recent audit by the Government Accountability Office found quite a few holes in how HHS financially accounts for the program. Federal News Network's Terry Guertin dug into the details with GAO's Director of Financial Management and Assurance, Jim Dalkin.
This program, TANF, which stands for Temporary Assistance to Needy Families, it really comprises of two parts. One is direct cash assistance, and the other is assistance through a program such as career training or childcare. And eligible families receive that. They receive it from the state. The money is passed through from HHS, Health and Human Services, down to the states. And each state is required to have an audit. It's known as a single audit of the program. And that looks at a number of factors, including the financial statements. It also looks at internal controls and compliance with federal laws and regulations. And the errors you noted, the weaknesses you noted, were findings, and there was a substantial number of findings. Now, this goes back. We examined 2023, and we found about 56 material weaknesses, and we also found another 90 significant deficiencies. What's the difference? Well, a finding is an audit observation, which could indicate the need for improvement. A significant deficiency is much more significant, and that management should be very aware that this problem exists. But material weakness is the most critical of the findings, and that's where they had 56 material weaknesses.
When there are so many repeated findings and material weaknesses across the board, what are the risks to government?
Well, I think there's a risk to the program and in program integrity. I think there's a risk that the wrong services could be delivered to the wrong person or eligible people. And there's just risk with respect to internal controls. And HHS wants to wisely use taxpayer dollars. So when you have a lot of these findings, that indicates there are some issues.
So there are probably risks to the recipients of the services as well.
There could be. Funding is limited, so if it's being used for purposes other than intended or to the wrong people, then the others are losing out.
Are there states that do a good job of managing the TANF program?
We did find variability between the states. So some states had much fewer material weaknesses and findings. Other states had much more. Some states hadn't submitted their required reports on time. Some states had many repeat findings over a period of years. So it really varied, I would say, by as many states as there are.
Do you have any explanation for that variability across the states?
Well, the states have a great deal of flexibility how they administer the programs, and I think that probably is a factor here.
So is one of the benefits of GAO's look across the board an opportunity for the states that do it well to share best practices?
Well, I certainly think that would be a good practice. And with this report, that might help them identify areas that are challenging and have some state-level discussions.
I'm speaking with Jim Dalkin, the Director of Financial Management and Assurance at the Government Accountability Office. Let's go back to the audit process, because this was like auditors auditing the auditors, and you were looking at the Administration for Children and Families that manages and provides oversight for the grants. What did you find there?
Well, we found some challenges, and what the organization needs to do is they need to monitor the reports coming in to make sure they're coming in on a timely basis, and then to look at the findings, which would include material weaknesses, to determine how is it we can help the states, because the states are required to put together a corrective action plan, and HHS is required to review those corrective action plans and work with them to resolve them so they don't reoccur the following year. And that's a very important part of HHS's oversight.
As a result of those findings, though, you made some specific recommendations to the HHS secretary. What did you recommend, and did HHS agree with you?
Well, we had three primary recommendations. One was for the Administration for Children and Families to revise their audit resolution process. And what we mean by that is they not only need to identify the findings, but they also need to work to determine if this resolution actually results in a better outcome. And so that was recommendation number one. Number two is that they had a backlog. So ACF, which you referenced, had a backlog of audit findings, and they need to catch up to that backlog. So that was our second recommendation. Our third was that HHS has the ability, under certain circumstances, to impose penalties. And we recommended they essentially tighten up that process, and that would be a third recommendation.
The federal government doesn't really manage the actual distribution of the resources. They manage the states who manage that. And as HHS is facing a significant personnel reduction, what's your sense about whether or not they have enough people both to really provide effective oversight, but then also to fix the weaknesses that you've identified?
Well, our report covered through 2023, so to the extent there been any changes in the staffing, we wouldn't have looked at that. But they do need skilled people, employees looking at this oversight. So I think that's important in order for them to move forward and address some of these findings that we identified.
So what do you hope happens next with the recommendations, given all the turmoil at the agency as you've released the report?
Well, I think it was pretty clear that there does need to be an improvement over oversight, and this is a very important program, and more emphasis on looking at these auditors' reports that they're receiving and making sure they're partnering with the states to resolve the issues. And I think that will result in better delivery to those that need those services.
Jim Dalkin, Director of Financial Management and Assurance at the Government Accountability Office, speaking with Federal News Network's Terry Guertin. We'll post this interview along with a link to the report at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive wherever you get your podcasts.